It's a very fluid situation that we're dealing with, and it's an unprecedented circumstances. We see case counts being what they are. We've not experienced that throughout the last 2 years of dealing with the Delta variant. So in that regard, we felt it really imperative that we hear from our most senior people in the state, men and women who are running our top health care organizations, to add today to some perspective on where they think we are and what's ahead, the road ahead. I want to talk to you this morning afterwards about where we look at things from the city standpoint, what we're prepared to do about that as well. And it's all about going forward.
Mahalo, Mayor, for including me in this important conversation. I just want to start by thanking Jill and Ray and their respective organizations, the Queens Health System and Hawaii Pacific Health. They've taken incredible care of the people of this state from the very beginning of this, whether it was because whenever somebody needed acute care, they were a hospital there for them, but also they set up mass vaccination centers to make sure we can get people vaccinated, ready to go. They've just been extraordinary. And because they've done all of that, I have had the luxury of being able to sit and think about what is best for population health for our 765,000 members at HMSA, which is more than half of the population. So essentially we're talking about the population of the state of Hawaii. I can think about that, what's important, because I know somebody's taking care of them if they get sick. And most of our state is not going to require a hospital, so we have to also think about it from that perspective. What about the ones who don't get sick? With that preamble, I'm going to say Happy New Year as well to everyone. It's 2022. This is the third calendar year we're dealing with COVID. And that might sound terrible and kind of depressing, but it can be viewed in an optimistic, positive way. And the reason for that is if you look across the history of mankind and respiratory pandemics, typically respiratory pandemics become endemic, meaning that we learn to live with them or coexist with these infections about the third year. Okay, and this is now the third year. So why the third year? Well, because three things happen for something to go from pandemic to endemic. The first is the virus changes. The second is medical science advances. And the third is people adapt. Okay, so let's look at those three things, what we got here. The virus changes. So what we have now is we have a virus mutation. We're dealing with Omicron. That means right now for this virus, it's more transmissible, a little less virulent. So it's exposing more people. So it's mutating and it's becoming less novel. It's not as new to the human immune system because more people are exposed or infected. So we can get used to it. In future iterations of this virus, our body will remember and know how to fight it. That plus vaccinations is really a big help. So that's the first thing, the virus is changing. The second thing is medical science is adapting and advancing. The most important advance we had is this incredible mRNA vaccine, developed at incredible speed, that is protecting us in incredible ways, especially if we get boosted. That is phenomenal, and everyone should take advantage of that extraordinary medical science. But other things have helped as well. Rapid tests have developed. That's helped us with population screening. We've gotten better pharmaceuticals that make sure people don't get severe infections if they get infected. All of those things have helped. So medical science has advanced. The third thing is people adapt. And that's where I think we can all continue to do our part to make that piece better. So the first part of adaptation, I think, is vaccines have to become routine and not political. Okay, so think MMR, measles, mumps, rubella. Think DPT, diphtheria, pertussis, tetanus. Think polio. Think of hepatitis. All these vaccines that we just get routinely without worrying about what party we're affiliated with. That's what we need to have happen with vaccinations. And boosters, of course. The second thing is common sense has to become common. So look, infectious diseases will just always be infectious, right? No matter what. So the bottom line is if you're sick, stay home. If you're in a high-risk situation, wear a mask. If it's peak season, try and avoid high-risk situations. These kinds of things are common sense. Use good hygiene, all of these other things that should be common sense for managing an infectious disease. And the last thing is And this is really in line with the mayor's call for personal responsibility. I think it's really great that he called for that, because we just have to learn to use the tools we have in our arsenal to learn to live with this disease and mitigate the impacts it can have on our lives. I mean, look, we've gone 3 years now, going on 3 years, sacrificing our mental health and well-being because we've had to give up things we love. Our children have sacrificed 2 years of development because they've had to stay home from school. Like, it's kind of time where we say, like, let's figure out a way that we have all these tools, let's use them so we can move on. This is really, really important for us so that we can take this pandemic and move it to endemic. So again, the virus is changing, medical science is advancing. Let's heed the call of personal responsibility to make sure that we are doing what it takes to turn this into something we live with. Mahalo.